Once again, we are live from the Physician Center for Beauty. Welcome to the weekend, and I've been bragging a little bit about the compassionate and caring staff. Now you're going to get to see them at work. That's the beauty of television. Jolene Boswell's with me once again, and Dr. McGuire, of course, is here. And what procedure are we going to see?
We're actually going to see a hyaluronic acid called Restylane, and we're going to do it in kind of the upper face and the mid face, around the tear troughs, as well as right in this area through here.
All right, Restylane. So, Dr. McGuire, I'm going to let you do your thing, and tell me a little bit about your very beautiful client.
Well, yeah, she's gorgeous, obviously, and you know we start to lose some volume sometimes as we get a little bit older, especially in the under eye area for some people, or in the cheek and sort of what I call the mid face area, and it just makes us look a little bit tired and drawn, and this volume that's been lost here, if it's restored, just improves the overall under eye area, improves the appearance of bags. She doesn't really have bags per se, but she's got some hollowing here, and there's a shadow effect that occurs from this hollowing where it has kind of cast a shadow just above and makes us look like we've got dark circles, which we otherwise might not. So we're using Restylane today to fill this in, and Restylane is a filler made of hyaluronic acid, and there's several different types of fillers. There's Juvederm, there's Restylane, there's something called Perlane, there are several others. But I like Restylane in this area, in the under eye area, because it's very refined, it's very soft, and it doesn't take much, but we just make some injections here, very tiny little injections, tiny little needle. And what's interesting about this, in this area, it tends to last a long time. Typically, fillers can last around 9 months in other areas. Up to a year. In this area, it typically lasts about 1.5 years to 2 years. And for some people, it's an alternative to lower eyelid surgery, depending on their situation. So we're just going to be putting a little bit of ice on, just for a second. And this is not because it's particularly painful. We've put numbing cream on here and let that sit on there for a little bit. We just use some ice to minimize the chance of any bruising. So I'm going to be just injecting directly.
All right.
And what we do is, again, we do a topical numbing solution, which basically makes this essentially painless. The Restylane itself also has lidocaine in it as well. The area, has very little bruising, very little bleeding. It seems like, oh gosh, that seems like that would be an area that would be uncomfortable. But as you can see, she's sitting very comfortably. The area is going to get immediate improvement from the injection of the hyaluronic acid, and again lasts for quite some time. Restylane is a very nice choice. There's a lot of hyaluronic acids that are very soft and pliable and look very, very natural in the face, even just with a very small amount of material to be used.
All right. She's smiling, so you're exactly right. There's not a lot of pain involved, correct?
Not at all.
And doctor? We'll see results in about how long?
Well, that's the neat thing about fillers is we see results really instantly. I mean, with Botox or Dysport, sometimes it takes about a week to see results, up to a week. With fillers, we typically see the results, instantly. So when we're done with the procedure, we see what it's going to look like, and that's pretty neat. And then the result in this area, like I said, is maintained usually for about a 1.5 to 2 years.
All right. Once again, that's Restylane, Dysport, whatever the case may be, very comprehensive beauty right here at the Physician Center for Beauty. We'll be right back. Wave 3 listens live.